I'm Alessio. I'm from University of Turin, from Italy.
You were using images to research experiences of people with spinal cord injuries. Can you tell me a bit about your research?
My research involved 6 patients with the spinal cord injuries. I've asked, I've asked these people to take me about 5 images about the pathway towards autonomy, about the meaning of the pathway towards autonomy, and about the relationship between nurse and patient. And I asked them to take me at least five images, and starting from these images, I took a 6 separately deeper interview, semi-structured, in which I could explore starting from every image, the meaning of the image in the sense of my question. In one end of the pathway towards autonomy, and another end about the relationship between healthcare professionals and patients.
So, do you have a background in the arts that you wanted to use an arts-based research tool? Or what attracted you to using images?
I think that images are most effective in emotion transmission. No, one feeling, one emotion, it will be more immediate to being transmitted by a video or by a photograph, by a design, or by artwork in general. I think that is a good way to transmit to other people your emotions and your feelings, private feelings. Maybe something you couldn't speak or you are shy to explain or to perform is available to be communicated through the using of the arts.
How did you get interested in this type of research?
I'm interested because I think this kind of research could make make more nearby the professionist and the patient, because the quantitative research using questionnaires or using scales or other stuff to quote to rate a performance or a feeling or a state about a patient could make some distance between me and my patient or my caregiver patient, no? And if you use a art method or a qualitative way to investigate about the feelings, about the in-deep emotion about the people you have in front, you could reach a more useful results, because people are more open to open their mind, no? Their deep emotions, I think.
Do you feel that this research modality is connected to feminism, or is there any relevance of feminism to how you're studying quality of life for people with spinal cord injury?
I think that this research method would be not the only one method to improve the quality of life of the people with spinal cord injuries. But I think that it will be the first step to better comprehend the world and the behavior, also the health professional behavior with the people and the families with the spinal cord injuries. Maybe in some images my patient talked to me, we could seen as angry people who don't take care gently about the patient or about the family. We passed away really faster, no? Between one and another patient. But if I could understand that my behavior is seen in this way from the patient or from their family, I could perform better my work, my daily work. I could modify a little bit my way of working, or the way I teaching the students to work with the better way to communicate with the people with the spinal cord injury, but with disabilities, and I could in this way improve their quality of life.
The images people made in your research study, your hope for that activity is that it will create better doctors.
Okay, I understand. Sorry. I think that my research will be in the future create more, not better, because I think we work good. We are good professionals, but I think it would create more human professionals that also listen to the problems of the people with spinal cord injuries, of the family of the family of the patient. I think our way to communicate in a specific way could be improved. There are part of our work they could be improved. So the answer to your question is yes, I think that the images and this research will be lead to have better professionals in the future. I hope. It's my hope.
far to the right, the most active people in the country would be to have to present active material. And only less than half of people would read an idea, and 1% have actually read it. So we thought that was a little fascinating actually, because we wondered if a lot of the sort of ethical concerns that might come up here were related to power sharing. And that
Jamen det var fordi dengang, hvor jeg var set det der.
Nå, der på...
Det var lige... Jeg har simpelthen tænkt, hvor jeg var begejstret nu, men det er jo ligesom glemt, ikke? Men det er det der med, at der er så mange muligheder, der er så meget, jeg har næsten ikke lyst. Altså, det er lige for mig. Jeg står og har lyst til at komme med det her.